I am on my way to assist a new patient named Bobby Thompson, who presents today with wheezing unresponsive to either his Flovent or Atrovent inhalers, both of which were administered by his wife following the onset of the attack. Upon his arrival at the clinic, this 22-year-old man was unable to lie down and had begun to use his accessory muscles to breathe. A brief history was given by his wife, and the patient was started on 4 liters of oxygen by nasal cannula. He was also administered an IV solution of 5% dextrose and water, to keep an open vein for IV access. The patient's vital signs and a laboratory workup were completed to allow for an accurate assessment and diagnosis. Bobby's blood pressure was 152/84, his pulse was 124, his respirations were 42, and his temperature was 38 degrees Celsius. Lab work shows his arterial blood gases were pH 7.31, partial pressure of CO2 48 millimeters of mercury, bicarbonate 26 millimoles per liter, partial pressure of O2 55 millimeters of mercury, and oxygen saturation of 88%. Let's talk to the patient and his wife and review his status. Hi, my name is Annie and I will be your nurse today. I have your chart here, Mr. Thompson, and it looks like you went through quite an ordeal earlier today. How are you feeling right now?
He seems to be doing a little better. He's still having trouble getting in a breath.
We will place him in a high-seated position and will show him some deep breathing and pursed lip breathing exercises to alleviate his symptoms and give him some temporary relief.
Is there anything I can do to help him right now? I'm so worried about him.
I can see that this situation is difficult for you. Another thing that can help ease his breathing is to promote a relaxing environment and stay by his side to help reduce his anxiety.
He will also receive medication, right?
Yes. Bobby, we already have you on oxygen to help, but let's give you the medication the doctor ordered. This is albuterol 2.5 milligrams plus a nebulizer treatment of ipratropium 250 micrograms. This should help to ease your breathing difficulty.
This isn't the first time that Bobby has had an attack like this. How do we know when it is serious?
Some of the signs that might indicate that Bobby is having an attack include labored breathing, wheezing, cough, shortness of breath, chest pain and tightness, and anxiety. If he does experience any of these symptoms, he will need immediate treatment.
Does that mean taking him to the emergency room is the best idea if he experiences any of these symptoms?
Often, asthma attacks can be treated with a rescue inhaler or at-home nebulizer treatment, but if these options don't work or if Bobby is turning blue, experiencing fast heart rate or says that he feels like his heart is racing, sweating, confused, or if he loses consciousness, he should be brought into the hospital so we can treat him for the attack.
So those are emergency signs to look for. Thank you for telling me. Those sound pretty scary. I never realized that he could pass out or be at serious risk.
Asthma is a serious disease, but it can be managed with medication and by avoiding the things that cause or worsen Bobby's attacks.
Is there a reason why he didn't get better when I gave him his inhalers?
Inhalers like the ones you gave your husband are okay for day-to-day control, but they act slowly and are not adequate to open his airways during an asthma attack.
I did not know that. Even under the circumstances, I am glad we came in today and were able to learn about treating Bobby's asthma.
Absolutely. Bobby's condition is chronic, which means it can be cured, but continuing use of his long-term medications to reduce inflammation can help control and prevent future attacks. I will show you how to use an inhaler and we can go over developing an action plan with Bobby to respond to his symptoms if the case of a future attack. Bobby can also keep a journal of his asthma symptoms and the circumstances under which they occur so that some of the causal factors can be identified and so we can see what treatment steps help to alleviate his symptoms.
That sounds great. Thank you so much for your help today.